Welcome back to Cancer on the Street. I'm your host, Dr. Malola Salako, and today we are talking about what we put into our bodies through our mouth. This is episode 4, based on chapter 4 of the Gifts of Survivorship, and it is titled Food and Fruits Nourish Your Body, Boost Your Immunity, and Reduce Inflammation. So, after a diagnosis, one of the first things people try to change is their diet. And you will hear thousands of different opinions. Don't drink this, quit sugar, drink only shop, take the juice, go vegan, eat grass, eat monkey, eat this. And there's nothing we've not heard. Today, we're moving away from these myths and misconceptions, and we're moving towards a lifestyle of rainbow nutrition. Joining me to help us plate up for survivorship is a registered dietitian specializing in oncology. I've been privileged to work with him for the past 1 year, and I love working with him because he knows how to take care of my patients. I see them glowing, I see them growing in good health. And join me to welcome our dietitian. Welcome, Charles.
Thank you very much. I'm glad to be here. This is quite an interesting section. I've been looking forward to it. Okay, so my name is Ogwipe Charles. I'm a registered nutritionist dietitian. I'm currently practicing as a specialist dietitian in oncology, and I'm glad to be here today.
Excellent. So, Dietitian Charles, I've published a new book. It's called
Okay.
The Gift of Survivorship, You're Bigger Than Cancer.
Okay.
And the 4th chapter is titled, Food and Fruits, How to Boost Your Immunity, Reduce Inflammation, and Nourish Your Body generally. In practice, there are many times I have seen patients come in malnourished. They are not eating well. I've also seen a lot of patients who are going through chemotherapy and other cancer treatments, and they have a lot of side effects. And they're not repairing as quickly as they should, partly because they're not eating well or they're malnourished. What's your experience with this?
I think this is an interesting question because these are things we really need to talk about when it comes to cancer prevention and treatment. I'd like to start by saying that nutrition plays a major role in cancer treatment as well as prevention. In fact, it plays a crucial role by reducing the risk of cancer, by modulating inflammation rate, immune response, and the rest of them. A lot of patients, when they are newly diagnosed with cancer, a lot of things happen to them, just like you said. There's what is called unintentional weight loss, which happens as a result of them not feeding well, or what we call anorexia nervosa. They are more worried about the diagnosis than feeding.
You said unintentional weight loss.
Yes.
That's not related to diet.
Oh, well, I would say unintentional weight loss could be seen in two ways. It's not related to diet, could also be related to diet because they are not feeding enough. Two things happens. One is when you have cancer, you might experience what we call cancer cachexia, which, there's a lot that is demanded from your body, metabolic rate, and you begin to lose weight. That's one aspect.
And that's not within the patient's control.
Exactly.
It's unintentional.
Exactly.
It's the cancer causing them to lose weight.
Yes. But secondly, they also lose weight and experience few other things because they do not feed well. This is where anorexia nervosa comes in.
Anorexia
nervosa. Yes, we call it emotional feeding. So it happens when you're sick, you're more worried about the pains you're going through, and nothing makes sense to you again. You don't feel like eating when you see food.
You've lost your appetite.
Yes, you've lost your appetite. So a loss of appetite happens to them.
And there are genuine reasons why that happens.
Yes.
Some people have like stomach cancers, cancers of the throat, and anytime they put something into their mouth, their digestive system throws it out.
I agree.
Then there are some people that have like ovarian cancer and their tummy is bloated. And they have this reduced sense of hunger.
Absolutely.
And that's not really their fault. There are these people that have these symptoms that they are scared emotionally. They're rationing should I eat?
Yeah.
If I eat or drink water, my tummy will get
Yes.
bigger. Okay. So
Okay.
I like how you've divided it, that there's intentional
Yes.
weight loss, they're not eating well,
Exactly.
and there's unintentional weight loss
It has to do with the cancer, what is going on in their system.
system.
Okay, so for these people, when they don't eat, what happens to them is that they have reduced immunity. At that point, they are not giving the body what it wants. They're not giving the body the nutrients it needs, even while the treatment is going on, or even before the treatment starts happening.
So their immunity is reduced because they are not eating enough.
Exactly.
And they are not eating the nutrients required to boost their immunity.
Absolutely. The kind of nutrients, the kind of food that their body requires at that time.
So what type of food boosts the immunity?
Great. So for immunity boost, there are two major nutrients. We'll look at macronutrients and micronutrients. Majorly, the immunity boost comes from majorly the micronutrient, and then the macronutrient also plays a major role, like the king of nutrients, they will say, protein.
Protein.
Yes.
Okay. So why is one macro meaning big? And
Yeah.
why is one micro meaning small?
Also, my macro is the body demands these nutrients in a large quantity
On a daily basis.
on a daily basis. And it's evident when you don't eat enough of those macronutrients. It's evident in the way you look, especially when it comes to your size, your weight, and the rest of them. So
Your energy level.
Energy level, absolutely. So these macronutrients, for example, your carbohydrates, your protein, your fats, your oil.
Okay, so there are like 3 to 4 of that.
Yes,
macronutrients that build the energy, build your body. Is it mass, muscle?
Yes, body mass, body muscles, repairs tissues, gives you energy and strength.
Carbohydrates,
protein, fats,
and oil.
Yes.
Okay. And then the micronutrients.
Great. So the micronutrients, most times we demand it in a very little quantity. However, they play key role in treatment process. These micronutrients, when they are deficient, they are evident, and they would not allow the patient recover speedily. Say, for example, for a cancer patient, you see most of them will have what we call, if over time they're not being taken care of, might become anemic. They don't have enough
anemia. Low iron.
Exactly.
Which can be found in...
Are you talking about iron sources now?
Yes, iron sources.
Oh, great. Green leaf vegetable is a typical example, and then few organ meats can also give
like
you that.
liver,
Exactly.
spleen,
They can give you
and
that.
vegetable.
Yeah.
And the popular one is ugu.
Yes, ugu is also a good source. And there are a lot of other micronutrients and minerals. We can't, we can't do without them. So that's why when we are screening some of these patients, we want to look at their creatinine level, their electrolyte level. We want to look at their blood work. Sometimes we want to see what their leukocyte is like, their immunity and all. So these key nutrients like magnesium, phosphorus, potassium, these are minerals. And then we'll talk about vitamin B, vitamin C, which helps to strengthen the immunity. Of course, I'm sure when you talk about boosting immunity, first thing that comes to mind is vitamin C.
Yeah.
So these are key vitamins, thiamine, niacin, that helps to boost immunity. So I do think that these nutrients should be put in check when we are talking about cancer recovery.
Okay. So dear Cancer on the Street listeners, Dietitian Charles is saying you should have a plate full of macronutrients and micronutrients on a daily basis. Macronutrients are carbohydrates, proteins, fats, and oils. Micronutrients, we need them in smaller doses, and they are vitamins and minerals. And when we talk about minerals, some people, not a lot, some people think minerals is minerals that we drink.
Oh no, that's not what it is. What they drink is called soda.
Mm-hmm.
Yeah, so that's the artificial one.
That's the artificial one.
It's industrially manufactured, and that's not the minerals we're talking about. We're talking about natural minerals.
Natural minerals.
from food.
Yeah. And something powerful about the micronutrients is where they come from, the sources. They don't You don't find micronutrients a lot in carbohydrates or protein. People like to fill their plates with the rice, the swallows, but micronutrients, which are required in small quantity, essential, are found in.
They are found more in our fruits and vegetables. They are packed in the fruits and vegetables. That's why when we talk about eating right, according to American organization, you will understand that our plate is meant to be 50% fruit and vegetables, and then the macronutrients, that's your carbohydrates, your protein, and your fat, you take the remaining 50. So for a healthy plate, it has to be half vegetables and fruits, and then you will have the other nutrients.
Okay, what do you think about our diets?
You mean our local diet?
The average Nigerian's diet.
Oh, well, so I think the average Nigerian diet is more in carbs, and then
Carbohydrates.
there's a little bit of protein intake and all. But the challenge I think we have, or what I see we do, is in the preparation. Preparation alters some of these nutrients and affects the way our body receives them.
Oh, how so?
Great. So, say for example, you want to eat egg. Egg is healthy. We say it's a lean protein that is required.
A macronutrient.
Egg, yes. So, however, you see a lot of persons prefer to fry their egg all the time. So when you fried egg, we talked about lean protein. When you fry egg, what you've ended up doing is you've added more fat into that egg because you're using oil to fry. And when the fire hits the oil, it alters the chemical structure of the oil. Thereby, you are adding more fat to the egg. So your body is not going to receive it, or is not going to utilize it the way someone who boils his egg loves to take it. I am not saying frying egg is absolutely wrong, but I'm just telling you the difference when I talked about altering the nutrient structure.
Okay, so I have two fire questions.
Okay, I hope I can take those.
Rapid answers.
Okay.
Does cancer feed on sugar?
Okay. So I have been doing a lot of studies recently, reading all kinds of research and all, and unfortunately, I have not been able to find any that states that sugar feeds cancer. That's what I talked about. So sugar does not feed cancer.
So you're settling that sugar does not feed cancer.
Yes.
And what have you found out?
Okay, so I read a couple of things that talked about cancer cells feeding more on sugars. But I also found out that the normal cells also feed on these sugars. What the scientists are actually debating on is on the environment where the cancer thrives. Does it have to be alkalized? Does it have to be acidic? And then, so it's not particularly about sugar. And now, when we talk about acidic environment, it does not particularly talk about sugar. However, it talks about processed food. A lot of processed food could create enabling environment for cancers to strive, to grow, so, and not sugar, because sugar does not feed cancer. If you take away sugar from human body, the entire body is going to suffer.
Shut down.
And then for a patient who is trying to recover, you are not going to recover. There's not going to be any energy, calorie, and the rest of them. And it goes as far as affecting our memories and the entire organs. You can't think without sugar. When we talk about sugar, we're talking about glucose when it goes into the body.
Okay, so as an oncologist, I'm tired of this question about cancer feeding on sugar. From experience, cancer is such a complex disease that it feeding on glucose, sugar is very tiny in how it operates as a disease. Cancers have the ability to hide from the immune system. They have the ability to form new pipes that attach across the body to get blood supply and take nutrients. So when people say, oh, I'm not eating carbohydrate, I'm not eating fruits because I don't want sugar in my system, it's really not true. That's not how cancer feeds.
I agree.
Yes, cancer uses glucose, which is a converted form of sugar in the
Yes.
system. But the way it processes glucose is not necessarily from the food supply. The body has a way of producing its glucose, one of which is food. But within the system, the body actually produces its glucose. So this is just to share with listeners and readers that we want you to have a balanced diet. If there's one thing you will take away from this podcast, is the fact that you should have a balanced diet. And I want to use a catchphrase, which is the rainbow balanced diet. Dietitian Charles, can you just tell us more?
Oh my God, there's a lot about that. Okay, so the rainbow balanced diet, well, we'll talk about it. We're looking at different colors in a plate. So that's why when you look at what is before us, it has a bit of different colors. And
Red,
food needs to be colorful first.
green,
It needs to be attractive.
yellow.
Orange, green, and the rest. So first off, food needs to be attractive. If it's not attractive, nobody's going to go for it. That's the first thing that happens. So the color is appealing to the eyes and you're going for it. So the good thing about it is that the different colors have what they represent. Let's streamline it to cancer or phytonutrients. Let me talk more about the phytonutrients. So when you talk about color deep red, which everyone can see, yes, something like that.
Napoli
But
day keeps the doctor away.
great. Deep red. So we'll talk of yeah.
So are you saying that the phytonutrients make this deep red in color?
Yes, they do. And they also have key other functions they do. So for example, in turmeric, that color there, what it
Golden
does.
yellow.
Exactly.
Yeah.
So, but for deep reds, as I was saying, when we look at deep red, what comes to mind is what are the vegetables and fruits that are reddish? So you're thinking of tomatoes, okay,
Atarodo,
exactly, chili, and the rest of them. And so what it represents, you can say like coped, which is a type of phytonutrient. So what it does majorly is it helps the heart system, it helps to protect it. It's also rich in antioxidants and the rest of them. Then you have your leafy green vegetable. It's everywhere, the color green, it represents immune support. It supports the immunity, just the way it is. It also helps in it contains a lot of antioxidants, of course, that helps to fight off free radicals in the body. It helps the skin as well. And then you have your oranges. Different colors represent different things, I would say.
Okay, so you touched on antioxidants.
Yes, ma'am.
Can you describe it and why is it important
Great.
in cancer care?
Great. So when we talk about antioxidants, their major work in the body is to fight off free radicals. They need to detox it, they need to take it off your system.
So what are free radicals?
I would say it's a chemical waste, that happens after metabolic processes in the body. So these wastes, when they are not removed, it could be gotten from anywhere. It could be gotten from, the things you inhale, the things you rub on your body, and then what goes on in your system. But they are not meant to stay in the system. So the job of the antioxidants majorly is to fight off free radicals from the body. And these antioxidants can be gotten naturally from food. Majorly, you have your vegetables and fruits. They are very rich in antioxidants. You also have your healthy herbs, which have, not just antioxidants, they also contain anti-inflammatory properties. We're talking about your turmeric, your garlic, your ginger, and the rest of them. So for
Cinnamon.
yes, sorry, excuse me, yes, cinnamon and all. So for a cancer patient who is going through treatment, we want you to take food that are high in these antioxidants, that have great properties that will help you fight off free radicals, help you deal with inflammation. Of course, once you have cancer or you're sick in your body, there's some level of inflammation that happens.
It's going on.
Yeah, it's going on. So we need to reduce it, not entirely. I mean, you cannot prevent it, but we need to continuously reduce. That's why the type of food you choose is very important.
Yeah. So, when we're treating cancer, one of the ways chemotherapy and radiotherapy works is to cause a lot of reactions in the body. And even without cancer treatment, there's a lot of chemical reactions going on. As you said, in response to what the body is exposed to every day, some of us are exposed to the sun,
Absolutely.
some are exposed to stress, some are not drinking enough water and they're dehydrated. All of these scenarios and situations cause chemical reactions. When these chemical reactions occur, it's just like you're lighting a fire. And the smoke being produced by that fire is what we call free radicals. Now, for us to get the smoke out, we have to open the windows so that good air comes in and the smoke goes out. So a good diet made up of things like ginger, turmeric, and all those wonderful things you said are the fresh air that comes in and mops up all those smoke and the free radicals that have occurred due to the reactions from whatever and whatever reason. So it's important for us to eat food that helps our body repair, because the more the free radicals, the more the body is damaged.
Exactly.
The longer free radicals stay, the less our body is able to recover and repair itself. And something has to go in to mop it up, and it is what you eat. And that's why that adage of you are what you eat. Something I would like us to touch on that is written in chapter 4 of the book is bacteria. We have good bacteria, we have bad bacteria.
Yes.
And our intestines from the tip of our lip all the way into our esophagus, into our stomach, intestines, and all of that is made up of 1,000,000 bacteria.
Yes.
And apparently, many people don't know this, that almost 70% of our immunity is in our intestines. And so what we eat promotes the good bacteria or promotes the bad bacteria, and that has an effect on our immunity. So can you tell anyone who's listening how they can promote the good bacteria?
This is one aspect of health we really don't talk about much. When you talk about bacteria, they play a major role in our immunity, which is the protective part of the body. If your immunity is strong, you're going to be healthy. It helps to fight off disease and all. And these bacteria sit there doing the work. Now, there's what we call prebiotics and probiotics. These are good bacteria, both of them. But now the prebiotics serves as a food to the probiotics that way. So when there's a chemical reaction or metabolic processes in the body where they protect these bacteria, protect the gut system, helps in things like in cases of constipation, diarrhea, and the rest of them. What we need to do to promote the good bacteria, first off, is to eat right by providing the right kind of food to these bacteria. Fiber is very rich in antioxidants. So fiber helps the gut system. In other words, it helps to protect the immunity of the gut system because it feeds the good bacteria.
So you're recommending that we eat more fiber because it's rich in antioxidants, which helps the good bacteria.
Exactly.
So what are examples of food rich in fiber?
All kinds of food. There are carbohydrates that contain fiber. So, when I'm prescribing or recommending food to cancer patients or anyone who is sick or making a meal plan, you would see oats. You would see things like millets, oatmeal. You will see things like millets. You will see a lot of other food that contains natural carbohydrate. I call them complex carbohydrates that have long chain sugars. They contain fiber as well. So these are the food that you can eat to help the gut system. More still, we have banana, we have yogurt. So these are like probiotics and prebiotics. What they do is to feed the healthy bacteria that helps to protect your gut system, that eventually helps to protect and boost your immunity.
So there's a recent trend now where people are, in Nigeria, people are taking parfait, are taking yogurts. I think 10 years ago, people were not like, what's yogurt?
I agree. So yogurt also is a good source of I think probiotics that help to grow the good bacteria. You
bacteria.
feed the good bacteria. Not just for cancer patients. I also recommend it for ulcer patients.
Yeah.
These are people who are dealing with gut issues. They have to be on high fiber diets sometimes, except they're not taking it in excess, because it helps to deal with constipation issue mostly, and these are some of the side effects you see in cancer treatment. During cancer treatment, you see constipation happens, diarrhea, vomiting, nausea, and the rest of them. So these are examples of food you can eat to boost the good bacteria in the gut system.
And something I hope people can relate to is here in Nigeria, where many people have access to antibiotics, and people are taking antibiotics not prescribed. They have a fever and they just feel, oh, let me take this antibiotic. The danger to that is when you take antibiotics, it damages bacteria.
Oh yeah.
The good bacteria.
Absolutely.
And the bad bacteria that, So it is important to know that all of us have bacteria. Some of them are good, some of them are bad. If you eat a balanced meal that is colorful, healthy, contains the right portions on your plate, you are feeding the right bacteria.
Great.
But if you're eating a lot of carbohydrate, like 70% of your plate is carbohydrate,
processed food,
10% is processed food or processed meat, another 10% is maybe protein, and you're not even taking enough vitamins, vegetables, then you are promoting the bad bacteria. So the type of food you eat promotes the good bacteria or otherwise.
Absolutely.
And what happens when one has a lot of bad bacteria in the system?
Okay, so when that happens, that means the good bacteria are almost dead or suppressed, because the body is built in a way that sometimes it should be able to repair itself. That means the good bacteria should grow, replicate, grow, and the food we eat makes that happen. But when you have a lot of bad bacteria in the stomach, first off, what happens that it affects your immune system. It weakens the immune system to affect different aspects of your body. We're talking about circulatory system, respiratory, and all of that. That's the bigger picture to it.
In oncology, we don't talk about this well enough, and it's a superpower. It's a hack to getting better, boosting your immunity to complement the chemotherapy and radiotherapy.
It's going on.
Many people who are experiencing side effects, for example, someone takes chemotherapy and they're vomiting, they have nausea. Of course, they're not going to eat as much as they expected to. Chemotherapy can cause taste changes.
Yes.
So how do you support patients who are experiencing such?
Great. So part of what we do when we, assess patients in the clinic is we talk to them about nutrition education, and this nutrition education includes side effect management. These are simple tips, very simple but very effective. Side effect of chemotherapy is taste change or taste ball changes. Things begin to taste differently for you, taste metallic and the rest of them. So what we ask them to do is to follow few tips, like you begin to take mint tea. Mint tea, yes, or mint tea, however, which will alter your taste, make it better, enhance it, and then you can begin to take ginger tea, garlic tea, and the rest of them. Then we talk of constipation, this person is not, pooing enough, and the rest of them. we go as far as prescribing key fruits. For me, what I use majorly is fruit and vegetables. And before you know it, that is taken care of. There are a lot of other side effects.
And for those that experience diarrhea, what do you recommend?
Plant diets that will just stop that the
Passage of
excessive
loose
passage.
stool.
Yes.
So like
Excessive
what?
passage of, we can give them pap. Their pap is okay. We can give plantain. A lot of times people want to take bread.
Mm-hmm.
That's
Brat
very
diet.
exactly
Bread.
very common
White
practice in
rice.
Nigeria. Yes, you want to take white rice, want to take bread, and the rest of them. So
Gari.
drink gari.
Drink
Yes.
gari.
So the whole
Cassava flakes.
oh yes, but people always go for the easiest one. So, but the whole essence is to stop that excessive stooling.
Stooling. Okay, so supplements. We have the natural supplements in all the food types you have shared.
Yes.
And then we have the artificial supplements, of course, made by industries and companies. And some supplements are good. What do you recommend to someone, to two groups of people? The first group are those who are receiving cancer treatment. And the second group are those who are have completed treatment and are, 3-4 years after treatment.
Okay, to be honest, supplement, I rarely recommend supplement for patients. The reason is simple. I would want them to get recommendation from their oncologists or AMOs or whoever who's in charge of their health. We don't just recommend supplement based on its availability because you can as well get these nutrients from food. However, there are rare cases where you need, we'll call it emergency cases or immediate cases where you need to supplement their feeding so that they get these nutrients and vitamins real quick. Those are in cases of entire feeding for me. Entire feeding, this is where patient is not able to feed, is not able to eat food, no matter what you do. So you see that this kind of patient is not getting enough nutrients. The weight loss continues, the body continues to deteriorate. So we might consider ONS, that's oral nutrition supplements. There are a few of them here in Nigeria. But if there are cases of dysphagia, they cannot swallow. They can't do any of those.
So, for example, people that have esophageal cancer,
Exactly.
they can't swallow.
Yes, they can't do it. So what we do is we do either through the nose or through their stomach, through NG2, then we give them supplement. But for other supplements like calcium or few other things, I would always advise them to get recommendations from their oncologist or their doctor. So I don't just recommend supplement.
Yeah, and supplements are tricky because, of course, many people are saying this supplement cures this disease or cures cancer. And the truth is, supplement plays a role in boosting immunity, reducing inflammation, even serving as an antioxidant. Which is what we want, but it doesn't replace cancer treatment. And before you take any supplement, you have to be careful. You have to actually run it by your healthcare team, because sometimes what I see in practice is somebody is using 3 types of supplements, and in each supplement there's a high dose of a particular nutrient, so they're taking it in excess. Then some supplements actually interact with the treatment we are giving.
Absolutely.
And so we're not saying you shouldn't take supplements, but just make sure your supplements, you have run them by your oncology team. They know what you're taking and you have a tick on it to continue with it. Is there anything you would like family members who cook and support patients at home, maybe relating to preparation of food, storage?
Okay, yeah, for caregivers, people who have cancer siblings, parents, or you are out there, you are supporting them in one way or the other, is to take their nutrition very seriously because nutrition plays a major role in the treatment of cancer, in the management of cancer. First off, you need to take away processed food. Soda, your canned fish can be a lot
What
of
of canned milk?
yeah, well, canned milk is okay, but it could be a bit beneficial. So we can't extremely remove that. Milk is still okay, it's a good source of protein. However, we're talking about some of these food that have gone through industrial refines and have a lot of preservatives. This is where my concern comes. In my experience as a specialist dietitian, I've seen that over 70% of the patients I have seen are hypertensive. We are still collecting data, by the way, but we want to really know why that happens. So, but I found out also that it is as a result of most of them during my assessment, they consume a lot of processed food. Now, what is the worry with processed food? Processed food have a lot of added sugars and then preservatives to preserve the food from decaying. Most of these preservatives are made with sodium.
Which is salt.
Yes. So not outrightly salt. Salt is sodium chloride.
Ugh.
Okay, but same thing. But here, sodium chloride, but sodium mixed with other things, the job sodium does is to preserve the food. However, they elevate the blood pressure, like sodium, excessive intake of sodium can elevate the blood pressure of someone. And more still, a lot of processed food can, affect, does not keep the environment of the body of the person going through cancer healthy. So what I will advise them, take away processed food is not good for them. Eat more of organic food, natural food, you know. These nutrients, you get them in natural forms. It doesn't have to be in an industrial form. And lastly, read less on social media. You need to ask the experts so that you can understand, have a good understanding of how nutrition can help you recover.
I think this has been a brilliant topic because we've touched on very important things many people would pick one or two things from. And if you go into the book, you would read a lot of this relating to how you can boost your immunity with the different classes of food, how you can reduce inflammation with the nutrients, whether it's macro or micro, and how you can repair, nourish your body. It's been an absolute pleasure, co-managing patients with you. I believe that many of the patients we've treated together at Pearl Oncology Specialist Hospital, we've gotten excellent outcomes because the oncologists don't just focus on chemo, radiotherapy. We co-manage with you the dietetics unit. Our clinic is called Meals That Heal.
Yeah, that's absolutely true. Meals That Heal Clinic.
Yeah, and I'm excited when I see the meal plan, and I think you should touch on that.
So one thing we also do for these patients is to ensure that they have a comprehensive, robust meal plan that guides them on how they feed daily. So when we are creating these meal plans, we are looking at the nutrient composition of the food. We are looking at the macro, the micro, and then we are looking at the portions because we have a recommended dietary allowance for some of these patients. There are some we start in full strength and some we start in half strength and then progress. So the meal plan is a powerful tool that helps these patients guide them to feed. And in this meal plan, you see specific food sources. It's not about to say you're having protein, you're having carbohydrate. They're having the food sources, number of eggs they eat in a week, their bananas, is it one finger, two finger, all of that. So it's all broken down in the meal plan. And one interesting thing about the meal plan is that below it, we also put guides, specific guides for patients who have, you're being managed for cancer, you're hypertensive and diabetic at the same time. We also look at those comorbidities while preparing a meal plan for them.
If you have never consulted with a dietitian, it is important you actually prioritize it in 2026 or whichever year you are watching this. And there's a few examples of meal plans in the book, Gifts of Survivorship. You'll have an idea what a meal plan looks like, but I also encourage you very strongly to see a dietitian, not just you, everyone in your family. I have a meal plan. I love my white rice, but I've had to cut down because it's a lot of carbohydrate, and I did not appreciate it until I had a session with a dietitian, and I was guided about the amount of kilocalories I should be consuming a day. Prior, it was in excess, and it was such a revealing consultation. I recommend it to everyone, especially if you've been diagnosed with cancer. It would definitely play a role in your recovery and your survivorship. Thank you, and see you in the next episode. Thank you, Dietitian Charles.
Thank you, Mom. It's been a pleasure.
And so that's it for today's episode. If you found a gift in today's conversation, please consider sharing this episode with someone who might need to watch or hear it. You can find us on social media to continue the conversation. And don't forget to subscribe so you never miss a story of resilience. To buy the Gifts of Survivorship book or join the esteemed Gifts Book Club, click the link below. Thanks for being part of our community. Take care and bye.